Just 1 second. All right, good afternoon, everyone. Welcome to Wayne State University Center for Urban Responses to Environmental Stressors, Environmental Health Chat, or as Dr. James Blessman sometimes calls it, E-Chat. We're here to talk about today, is my home poisoning my family? Paths to lead healthy and lead-free homes. So my name is Rochelle Chapman. I am the Community Engagement Coordinator for CURES in the Center for Urban Responses to Environmental Stressors, and we want to welcome you all here today. I am quickly getting out of the way and passing the mic to our capable moderator for today, Dr. James Blessman, who is here with us, one of our stars and our highlights for the center. He's been around much longer than me. Not just like, but just around cures, and pretty much knows everything cures. And we are so happy to have him here. He's an assistant professor in the Department of Family Medicine and Public Health Sciences at Wayne State University. That's his quick title, but he has many hats, and he may tell you a little bit about those today. He actually doesn't have on his hat today. Normally, he would wear a hat. So we're happy to have you. Dr. Blessman, we are in your hands, and thank you for moderating us through this event.
Absolutely. I'm so grateful to be here. I will say, I like how you said he's been around here for a long time. That's your way of saying I'm old. I wasn't sure exactly where that was coming from, but it's cool. So my name is James Blessman. I'm one of the faculty, here at Wayne State, and I hang out with CURES also. I want to start though, before I talk more about that, with just a thought. My background is internal medicine and occupational medicine, and my mother would, the way I would explain it to my mother is, my job is to make sure that your job doesn't make you sick, which is not quite the same as being sick at your job, but I can help you with that too. And my goal for people is actually happiness, because I find that if I can get you happy, I can get you healthy. However, if I get you healthy and I don't maintain your happiness, you will not be able to sustain your healthiness, if that makes sense. So that's really my deal and what I'm all about. One thing I want you to think about is, if I were to cut you, your body would automatically repair that. It's going to send in white cells to prevent infection. It's going to send in fibroblasts to help scar it down. It's going to send in platelets to stop the bleeding. And you, in general, don't have to make one decision to make that happen. Your body automatically knows what to do. You don't have to give it permission, so on and so forth. However, if you create what I call an error of omission, so the body says, hey, we're going to need some vitamin C down here to prepare this cut. And your body says, well, we don't have any vitamin C. And you say, well, that's what I'm going to need to repair this. Well, I don't know what you're going to do because we don't have any. That's an error of omission. Your body is looking for something that it needs and it doesn't have. Or you have an error of commission. So let's say you are putting your fingers on both sides of the wound and you're spreading that apart. And that is your body experiencing something that it does not want to experience, an error of commission. If you don't create errors of omission and errors of commission, which are usually hazards in your environment, your body will find its way back to health. And that's the beauty of it. And you process about 100,000 billion chemical reactions in a second. So it's a very capable system. So your goal in terms of health is to prevent errors of omission and errors of commission. So on the issue of commission, that's where CURES comes in, because these are researchers and faculty who are very concerned for hazards in our environment and will help you to understand where those hazards are and how to control those hazards and remove these offenses from your life. And we have a very capable team of people and folks that we work with in this regard. And in that sense, what we put together for you today is talking about hazards within the home with the focus on lead. And I think you will you will learn a lot from our panel of presenters. And so with that, we will kind of get started in this. And the first up is Ms. Diane McCloskey, who is a parent who had experienced some of these challenges. And I had an opportunity to speak with her, and I actually learned a lot from our interactions with her. Because of her travels, she's become quite the activist in this arena, and she's going to share her story and share a little bit about her insights and have a couple recommendations for you. And so, oh, I'm sorry, I said Ms. Klowski. I mentioned the wrong person first. How's that for your MC? It's supposed to be, it's Allison McShane, who's our parent, McShane, who's our parent, who's going to speak first. And so I apologize for that. Ms. Klowski is coming last. So did someone flag me to say that I screwed that up? I didn't even see anybody tell me that I screwed that up. So yeah, there you go. How about that? So Ms. McShane, would you like to share with our audience your story and what you experienced?
Sure, I'd be happy to. Thanks so much for having me, and thanks so much for having this event and just doing so much for our city and leaders and communities. So, my name's Allison McShane. I'm a proud Detroiter. I'm pretty much born and raised here, but we recently we bought a home on the north end of Detroit a few years ago, and I got pregnant, and a it was a wonderful birth story, all of that. But this home that we bought had a lot of work that needed to be done, and we were slowly doing it. Just getting the roof was a huge step, but and we were living in the home while we were renovating, which we'll come to find out was not a great idea. But so 2 years ago, we were getting ready to undergo some more renovations inside the home after doing the roof. And it was a historic home. It was built in 1890s, so there was a lot to be done. And my son, who was 9 months old at the time, was happy and healthy, super energetic, and starting to explore the home. And so mom's instinct was a little concerned because there were parts of our home that we were closed off, but he was crawling around. So I asked the pediatrician to test him for lead in his blood, and she said, she didn't discourage me, but it was kind of like, we normally only test at a year, and this is only for children who are Medicaid recipients, and that there's not really a need. And I was like, well, can you just do it? And so she performed the in-office pinprick test on his finger, and we went about our way with his exam and his shots. And as we were leaving, she pulled me back off to the side and said, your instincts were correct. He's got elevated lead levels. His levels at a 10, and we need you to go to the hospital and confirm everything through a venous straw. So I went to the hospital, and getting blood from a 9-month-old is terrible. It's awful enough, but I was obviously very concerned. And so the venous straw revealed that he was at an 8, and so I immediately removed him from our house, because I was like, we don't know exactly where this problem originated from. It could have been a maternal exposure from me. It could have been, dust, like we're about to find out. So I removed him from the home right away, and we lived somewhere else and had the whole home tested. And it turned out that it was, dust pretty much everywhere, coming from the windows, the sills and just tiny microscopic dust. And he wasn't, crawling around eating paint chips, which is kind of what I thought that lead exposure, lead poisoning is from, is people literally eating paint chips. So I didn't think that the dust or the things that we were doing around the home were actually hazardous. I just kind of had a feeling that it wasn't a good idea, but I obviously learned a lot through this process. So we had the whole house tested, found it pretty much everywhere. The renovations and the abatement, the cost of all of this was just too much for our family to undergo. It added probably another $50,000 to abate it, which it just didn't seem, we just couldn't do it. So we actually bought another home nearby that was smaller, that had, was done. And we just kind of abandoned our dream of having this awesome big Victorian house downtown, and bought a smaller home. And this house, I had tested right away when we moved in, and there was lead on the walls. It was not, there wasn't dust anywhere, but it was on the walls. And as homes start deteriorating, the walls start deteriorating, plaster comes down, that dust breaks up and becomes, or the particles break up and become dust. And so I wanted it removed right away. So we went through the abatement process, which was considerably less, but still very expensive. And the contractors that we hired, I thought were very in the know. They said that they, were RRP certified, which is the remodel, renovate, paint certification, and said that they had huge government contracts. And when the contractors showed up and started doing some work, I was a little taken aback because they were pulling some, this was a side project. They were pulling some tile up and some the countertops, and they hadn't put anything out. And I was like, what's, why aren't you being more cautious? And he said, well, as long as your kid isn't eating paint chips, it's fine. Which is, I get the thought, because that's what I had originally thought. But yeah, I was really upset. So I actually went through the process of having their work kind of checked, where I called the testing company, and after they had done the paint, I had the testing company come out and test the house, and they had created a hazard. So like, they had brought in all this stuff, had a huge basically work plan that was supposed to involve HEPA filters, and made us relocate for a month, and then there was lead dust all over the floor. So I was like, you need to come back, clean all this up. And it delayed us moving back into our home. So and it was expensive because it wasn't part of it. And they were like, why are you going back? And I'm just like, I don't trust you, and this is why. So basically, my son's levels went down because we removed him right away. We abated the home. So we went through all of the, correct procedures, and he's doing great. He's 2.5 years old and super excited about Santa coming, and won't stop talking about this garbage truck that he wants. So he's happy and healthy. But this is such a community health problem, and a lot of stories don't end up this way. And I'm really lucky that, I guess that I had the time and energy to devote to educating myself. And it's inspired me to become an activist. So I'd like to share some of my lessons learned. Let's see. Down here. So basically, the biggest lesson learned, obviously, is that you don't have to eat paint chips to be exposed, that, you know, the hazards are everywhere, or there could be potential hazards everywhere, from the porcelain enamel on your sinks, to water, to outside ground, to just spices, makeup. I've definitely learned it could be a lot of places, and that the people who are deemed experts are not necessarily, and you have to you have to watch out for that, because there were many antecedents that could have stopped, you know, this poisoning from happening. My OB could have asked me if I lived in a house that was built before 1978 and tested me then. My pediatrician could have asked me if my home was built before 1978, and I realize that a lot of people don't know if they're renting, but you need to find out if you're, you know, expecting a child, or, you know, even just for yourself, because adults can be poisoned too. And the contractors, like they clearly didn't do their job. Every contractor, uh, it's a federal law that they be certified, and they should hand you this packet when you're getting work done. And if you're doing work on a home before 1978, you should definitely look into being certified with RRP, and they should hand you this little um, uh, packet. And then obviously, follow through with the things that are in it, with HEPA filters and removing, and checking for dust afterwards, testing and retesting. And it's not difficult to find out these potential environmental lead hazards, but it's expensive. It's every time we tested, it was between $600 and $1,000. Like the whole home test that we did in our previous home was, yeah, it was 1,000, and then every time it was $600, and it's like, you can get the little lead tests, and if you have something that's in a suspicion, you can get the little crack and test and find out, but to actually confirm, look for dust, and get a whole house you know, sweep of it, it's very expensive, and the correct abatement is so important, because you could create, in my situation, we created a hazard when there really wasn't one, like an active hazard. It was on the walls and could have been and would eventually, but it created a huge problem. And this goes from like hanging a nail to, you know, doing any kind of work in your home could expose. So you really need to be an advocate and an activist, and you can be an advocate through there's a wonderful organization that when your child is exposed, they notify the health department. The health department refers you to DLED, which has been awesome. Mary Sue's here today, and she's a wonderful advocate and helps us all. And DLED is the Detroit Lead, what is it? The Detroit Lead, I'm trying to get the acronym. Detroit Lead advocacy parent group that I've been a member of since we found out about all of this. And so it's a group of parents, educators, and community partners who are working to build awareness and create strategies to end lead poisoning for Detroit's children. So we meet every month on the fourth Thursday, and we have various speakers. And so it's not only very educating, like we have, you know, lead in the water, lead in the law, getting children's tested, proper nutrition. This past week, we had a lead and learning disabilities educator come. So it's been really helpful just having the support and education, but also, you know, just having a network of support, because a lot of people don't, you know, aren't as aware or educated until you're in it, unfortunately. And then it's helped me become a better advocate, a better activist. So you can basically you need to know what district you are in. You need to know who your city council is, know who your state representatives are, and lobby for this universal testing bill that's coming up. And this basically calls for testing at ages 9 to 12 months, again I think at 3, and then I'm trying to look, and again at 4, and it's for those in high risk areas. And it also has education for the pediatrician. So I think they have to be obviously more educated in lead exposures, lead hazards, and it also adds the lead exposure to a child's immunization record. So I think it's going to be reintroduced in a new session starting in January. So with the Democratic State House and Senate, we'll have a good chance. That's great. And yeah, I just wanted to open it up if anybody had any questions for me. I don't know if
Yeah, we can take a question too. I had asked folks if they had questions, to put them in the chat also.
Okay, I'm looking.
Allison, I do have a quick question for you.
Sure.
I was surprised that you already suspected something at 9 months when most people know nothing at all about lead. What was it that got you educated at least even a little bit to know to question it?
He didn't have any, signs or anything other than it was hard for him to go to sleep at night. I was very tired, but I guess it was living in a home that we were renovating that I was suspicious about, because I just, just from a little bit of education in psychology and environmental science, I knew it was a problem, but yeah. The biggest problem is that there isn't this great system in the real estate industry to inform a buyer. Basically everybody gets off the hook by saying they don't know when they buy and sell a property, or when they sell a property, and it should really be that it's every home is tested as part of the inspection process. And I wish that would have happened in both instances, because you should know, where these things are. And like I said, it's very expensive. But yeah, I honestly, it's just mother's instinct that I even tested him. And I wish I would have sooner, or I wish I would have tested the house sooner, and the canary in the coal mine wasn't my son's elevated level or his poisoning. It was the house being sick and not him being sick. Thank you.
Thank you so much for that.
Cost affiliated. Oh, somebody asked. I'm just looking at the chats.
Yes.
Yeah, they're talking about D-Lead and Mary Sue and how awesome she is, and okay, I don't see any, but yeah, thanks so much for having me, and I'm really hopeful that we will, as a community, come together and start addressing this, because it's just a huge problem, public health problem, environmental problem that we all really should be looking towards. So thanks so much.
Awesome. We really appreciate that. Hopefully you can stick around to the end. There may be more questions that come up as we go through the presentation. So thank you again. I will also make the comment that, and I hope I don't steal any of Chris's, Dr. Trentacosta's thunder, but I will say that, one of the ways it gets into the body for kids is mouthing, where about 40% of the lead ingested may be absorbed. If it comes in through the lung, almost 100% can be absorbed. One way that it can get there for the adults is that if you are smoking in an area that is contaminated with lead dust and the cigarettes become contaminated, as you smoke those cigarettes, it's just a very good vehicle for that to get into the lung. where you will absorb much more of the lead. So just want folks to be aware of that. Okay, so thank you very much. Next up is Dr. Trentacosta, who is a part of the Cures team. He's our leader, if you will, one of our co-leads. And Dr. Trentacosta has a background in clinical psychology, developmental psychopathology, and emotional development, mainly dealing with kids. Very interested in this topic idea. And, you know, we have asked him to come and have a discussion about lead in children, kind of impacts on children. So Dr. Trentacosta, your thoughts, please.
Thanks so much, Dr. Blessman, for the introduction. And thank you so much, Ms. McShane, for your incredible summary of all that you've been through with your family and your home. Okay, so I've got a PowerPoint to share here. So I'll just do that. And if I can get a thumbs up from anyone that you can, in fact, see that.
It's there.
Great. Okay, so I'm going to be talking about the impact of lead on children. And as Dr. Blessman mentioned, I am a clinical psychologist by training. I do research on child development, primarily focused on younger children. My experience in lead exposure is fairly recent because we psychologists don't necessarily focus on this much, and certainly not as much as we should. I will aim to give you an overview of what is known. So first, starting with sort of the good news overall, when we think about it, you know, the dangers associated with lead have been known for literally centuries. However, until the 1970s, the United States lacked major restrictions on lead from two of the really main sources of exposure: gasoline. There used to be lead in gasoline, and household paint, which of course Ms. McShane was talking about. So the good news is, if we think about this big picture, is finally in the 70s, the U.S. started getting its act together and addressing some of the main sources of exposure. And what you can see here is from a paper by Bellinger and Bellinger. They did a nice job depicting this, that as lead used in gasoline went down in the 70s, so did the average blood lead levels. And in fact, these blood levels are quite shocking when we think back, especially compared to, you know, the levels that are still high, elevated, and concerning that Ms. McShane was sharing back in the 70s and before that, that the levels were tremendously high. But they've gone down a lot, both because of the removal of lead from gasoline and because of the restrictions on lead and paint. However, and this is where we get into why this continues to be a concern, even at low levels, or what used to be considered low levels, we'll call it that, but lead exposure is linked to several things. And we know this from now decades of research, including more recent research, you know, focusing on these sort of lower levels, so to speak. So lead exposure is linked to ADHD, attention deficit hyperactivity disorder, other behavior problems, including childhood aggression, and also later delinquency and crime. And there's even been some research showing that as lead was removed from sources over time, crime levels went down in different communities and society. So the removal of lead may actually be a factor, at least somewhat of a factor in drops in things like crime rates and things like that. But lead exposure is also associated with cognitive difficulties, including lower IQ and other negative outcomes across the lifespan. This isn't just a factor for children, but across the lifespan, including increased risk of death from factors such as cardiovascular disease. So we're really talking about a wide range of effects across the lifespan. So let's talk about the CDC guidelines, therefore. And this is important and interesting information because the CDC has been lowering and lowering their guideline of concern levels for blood lead levels. And it's currently down to 3.5 micrograms per deciliter. From those much higher levels, both in the CDC guidelines and to what was actually the typical levels that people would have in prior decades. And so that level is to identify children with blood levels that they are considered higher than most children's levels. However, also from the CDC, important information that, and this I quote, and I think it's important we keep this quote in mind, no safe blood level in children has been identified. Even low levels of lead in blood have been shown to reduce a child's learning capacity, ability to pay attention, and academic achievement. So while we've seen this guideline drop, they're also kind of clarifying that there is no level that's known to be safe. Okay, so we need to keep that in mind. So which children are most at risk? And I think a lot of this really corresponds with Ms. McShane's experience and why we're focusing this, in our work at Cures in Detroit and in other cities with an older housing stock. So babies and young children, children from low-income families, children living in older housing, racial and ethnic minorities, especially Black children, refugees and immigrants from countries with high levels of lead exposure. So when we think about all of these factors, first of all, tend to go together. Families and children from lower income families often tend to live, especially in cities like Detroit, tend to live in the older housing and factors like that. But this is also why lead, while there might be other parts of the country, newer housing, wealthier communities, where to them lead may seem like a non-issue, in a community like Detroit, lead is still a hugely important issue. I just want to briefly mention too the prenatal exposure route, and this will be the only slide that involves research that I was directly involved in, but I just want to really show that as was previously referenced, babies can even be exposed in utero, and this is just from our own research showing that exposed fetuses show different patterns of brain connectivity in areas that are linked later on, have been linked to cognitive function and things like that. So this is just showing that the route of exposure can start in utero. But here I'm going to talk a little bit more about young children. Because it is the early years of life are a period of especially rapid brain development. Babies and young children absorb more lead than adults. So there's those, just physical routes of exposure processing through the body, which are especially important. They're more likely to ingest objects containing lead. That's just what babies and young children do, right? Putting their mouths on things and exploring. And curiosity is one of the great things about early life, but it's also a risk factor when we think about lead exposure. There's even a psychological disorder called pica, which isn't necessarily only a disorder of young children, but we often think about it with younger children. This disorder is where the individual eats non-food items, which could include paint or dirt. So that disorder is a case where you'd be especially concerned. So how are children exposed to lead? And this I'm summarizing from the research, but it fits really exactly with what Ms. McShane was summarizing from her lived experience and what she's become aware of. This paper, this research article that just came out and focuses on Michigan. So extremely relevant to what we're talking about here. Again, quoting directly from them, this study suggests that the main direct and indirect pathways of lead exposure for at-risk children remain lead paint and the contaminated dust and soil that it generates. So that, simply put, when we're looking at how our children are exposed, there are lots of routes, but this is the main. These are the main pathways we're talking about. So just to go into a little bit more detail about that, the primary route, which again, Ms. McShane, thank you so much for sharing your own experience that directly fits with this. The paint to household dust to child route is the primary root that they identified in their study of, many, many, many homes fitting with, people's individual experiences. Other roots involving paint in or near the home include direct ingestion of paint or paint chips, which again, that might be the misleading part, that you think that has to be the root. No, it doesn't have to be the root, but it can be, especially for a child with something like pica, or just a baby or young child who's exploring in the natural way they can. There's also a paint to soil to child route. So it doesn't necessarily have to be within your home. It could be near your home or playground or somewhere else. Or the paint to soil to dust to child route, which is another reason why it can be especially tricky, because there can be lead sources from decades and decades ago that are still out there in soil. Other sources, of course, water, we know from the Flint water crisis is an important source to consider as well. For example, babies having formula that's mixed with water. That's why babies are often, that's a particularly important route of exposure for babies, but also for other children and others too. Industrial sources are still, a source to be concerned about, and other sources like food and beverage containers. There are still potential lead exposures through those sources as well, even though they're, being regulated. So I want to conclude with prevention, and these are things that have already been touched on, but I think I want to summarize these kind of two main ways to think about prevention. One is primary prevention, which means, generally speaking, just preventing exposure across the population, not waiting for someone to be exposed. And these are programs, for example, to eliminate routes of exposure in homes or other sources. So these are the larger scale things that are important. Recently, the government investing billions of dollars in removing lead service lines for water, those kinds of things, but also highly relevant to these primary prevention approaches for homes, because obviously, well, it should be obvious that our ultimate goal is to prevent the exposure from even happening, right? Secondary prevention is important too, and this is screening to identify children who have been exposed, because secondary prevention means identifying potential cases as early as possible and getting them the support they need. So that is an important approach as well. But of course, that also means that you're identifying something when it's already happened, or when there's already been an exposure potentially. So it's really important to pair, when we think about broader policy and advocacy towards policy, thinking about both primary and secondary prevention as important strategies. So with that, I conclude. I thank you for being part of this. I'm here representing CURES, our Center for Urban Responses to Environmental Stressors. We have a lot of community engagement resources on our website, including fact sheets about lead and many other topics related to environmental health. And feel free to reach out to me. My email address is here. Thank you very much.
Thank you so much for that presentation. Are there any questions for Dr. Trentacosta? I would like to offer, while maybe someone might write some of those things, I want to emphasize a couple points. The first, the issue of no safe levels. That's very true. And the way to think about that, we don't know of any particular chemical process in the body where lead is necessary. So when it's being absorbed, it's usually getting in the way of something else. And it can cause, there was mention of some developmental problems, but some of the more acute effects, it can do hypertension, abdominal pain, colic, problems with your nerves in terms of numbness and tingling and that type of thing. So it can be a particularly bad actor. The other point I would like to emphasize, there was a mention of pica, which is the consumption of non-food substances, which is often associated with iron deficiency. The reason why that becomes important, pica might lead to the consumption of lead chips, but the other piece to that is, in the face of iron deficiency, the body will absorb more lead, thinking that it's iron or looking for iron. If it doesn't see iron and it sees the lead, it will absorb it. So pica can actually lead to a greater absorption of lead. The other point that I would like to make is that there is a concept of half-life if you're exposed to lead. So let's say you have lead in your blood, and in 30 to 40 days, you have half that amount. Another 34 days, you have half of that amount. So let's say it was at 40, it goes down to 20, and it goes down to 10, and it goes down to 5 with each particular half-life. The concern, though, in lead is that all of that, as it's going down, doesn't necessarily leave the body. Some of it is distributed to the bone, where the half-life in bone is measured in years, like 25 years. And so while it's not particularly thought that that's hazardous, you can develop stores that can then be re-released into your system based on what's going on. So that's the whole point of trying to minimize this, and why there should be efforts to try and get this out of our environment. And if it leads to policy changes to encourage that, that would be good. And the final point about that is, when we began to recognize some of this, and remember it was in paint, and particularly in even exterior house paint. And what would happen is you paint your house, and as a part of the washing process, it was kind of designed to shed, but that shedding was contaminating the soil around your house, which probably got me. I remember we used to go and kind of rub our fingers on the paint, and it would turn white and all that kind of stuff. So this what happens. No, I'm just saying. Did I get screwed up? I don't know. But if you look at what was going on around the time, there was real resistance to acknowledge the challenge in children. And part of the marketing, if you remember kind of the whole Dutch boy thing, was to put a kid on the paint can. It was almost like a look this way, don't pay attention to what this hand is doing over here. So I think we learned our lesson back then. Folks finally caught on and have interest in doing things differently, but it has been a challenge ever since. But incredible presentation. Thank you so much, Dr. Trentacosta. So any closing questions?
Just added one from Facebook.
Yeah, online question. What moods or emotions should you pay attention to that could alert you to concerns about lead poisoning?
Yeah. So that's a great question. I think we can't pinpoint just one specific mood or emotion. I mean, I think that speaks to the fact that the potential effects and the effects of lead uncovered from research are quite widespread. So it could be, if you could be seeing more anger, right, related to aggression or frustration. You could be seeing difficulty paying attention, so trouble focusing. You could even just be seeing a more subdued child. So I think I wouldn't encourage looking for just any one specific thing, but I think lead is a factor among many other potential factors, don't get me wrong, to be on the lookout for as contributing to a child who's having sort of mood or emotional struggles, no matter what those struggles may be looking like.
Yeah, I like that answer. I think a way to think about it is, for the majority of folks, kind of peace and sociability is the norm. And so where those things are being disrupted, where any type of negative emotion, anger, frustration, fear, so on and so forth, can be suggesting that there are processes that are not operating as they should. And while we're focusing on lead, there are other hazards that should always be considered too, issues of pesticides, or, there are any number of chemical solvents, cleaners so on and so forth, that can be disruptive to our systems of operation. So lead is certainly one of them, and easy enough to screen for. And we'll hear a little bit more about this in the next presentation. But I just want people to think of this in the larger context of environmental hazards in general. And there are others that we would bring into our homes, which again is the kind of the goal of cures, is to try and understand the impacts of these environmental exposures, and educate those on ways to address them. So awesome. Do we have another question? Let me see. How do you know that your rental home has lead? I live in Grosse Pointe, a lot of aerial homes, and that is my concern. I think, Ms. McCloskey, are you going to talk a little bit about that at all?
I am.
Okay, so what we'll do is we'll finish our last presentation. We'll keep an eye on the chat, and we will make sure that we distribute those questions, any questions that you might have, to the right person. So the last step is Ms. Diane McCloskey, who is the director of ClearCorps, who I tried to introduce her in the beginning as the parent who was going to be speaking about this. Yeah, that's, sorry about that. So in any event, ClearCorps is very interested in addressing issues regarding lead, or creating healthy homes for children and families, looking both at lead and other asthma triggers in the home. And so has a lot of experience in that area, and we thought we would have her come and have some discussions with you about your home and what you can do. So Ms. McCloskey, please.
Thank you so much. I'm going to attempt to share.
Your microphone sounds wonderful.
Oh, thank you. Rochelle, can you just share for me? I think that might be a little bit easier. So I'm kind of going to cover what do you do now? You know, what are some resources for healthy homes? First, I want to applaud our first two speakers, because I always start out with get the facts about everything and what happens to a child who is poisoned by lead. Dr. Trentacosta, you did a great job talking about that. And then how do you know if your child is poisoned? Get your child tested. So it's get the facts, get your child tested, get your home tested, which Allison did touch on briefly. So I'm going to talk a little bit today about, so what do you do now? You think your home might have lead poisoning in it. Potentially your child may already have an elevated blood lead level, but possibly you might be working from the prevention aspect, which is very important, because lead exposure is 100% preventable. That does not mean it's easy. It does not mean it's cheap. And it may mean that you need to braid and layer and leverage resources in order to accomplish a lead safe home. But I'm going to cover a few things related to that, and hopefully it will be of some help. So the very first thing on the next slide is, how do you find out if you have lead hazards in your home? So here's the facts. You need to get your home tested. You can do that in a variety of ways. If you are outside the city of Detroit, chances are your city does not have any kind of regulation on lead testing. If you are in the city of Detroit and you rent your home, ask your landlord to have your home or apartment tested and to give you previous test results. When you sign your lease, they are more than likely saying, I'm not aware. And you're just saying, okay, yeah, they gave me this lead booklet, which is 70 some pages that the state mandates that they give it to you. But Detroit has a rental registration ordinance where the landlord has to get what I call a health and safety third-party inspection and a lead investigation risk assessment, which identifies where the hazards are in the home before they can get certified to rent. Now, we do have a low compliance rate in the city, so many landlords are not doing it. Many families who already have children with elevated blood lead levels are afraid to ask their landlord because they don't have anywhere else to go and they're afraid they're going to get evicted. But what you can do is you can look up your address to see if your property's been registered. They've made some recent updates to this website, so it's a little bit easier to use. If you put in your address, it'll bring up a map that'll show the houses on your block, and there'll be codes on it to whether it is registered or not. Now, the important thing to remember is that there's a couple steps to getting a property registered. First, the landlord lets the city know that it is a rental property, and that's the actual registration process. Then they have the lead investigation and the third party assessment of hazards in the homes, more on the health and safety side. Once those two things are completed and they have, so to speak, cleared that process, then they get a certificate of compliance, which is considered the clearance. So what you'll see on the website is those who have totally completed that process. Can you go back one slide, please? You can also, if you find that your property is not on this site, you can report that to the city. I've been told that you can request a free inspection from the city. Now, I have not seen this actually happen, but if you feel that your home is hazardous, you can try this. I recently saw it on the news, and they had posted this phone number of 313-224-2733. That may actually go to the code enforcement department rather than the rental registration department, but it can't hurt to ask, because normally what happens is you need to hire, if you're doing it yourself, you need to hire a lead professional. And we'll talk more about that a little bit later. Next slide, please. If you have children under 6 in the home, you can apply to 2 resources. One is through the city of Detroit, who has a couple different lead hazard reduction programs, and another is through the state. But you must have children under 6 in the home. What'll happen then is they'll require your child to get tested. Your child does not have to be poisoned to qualify. They just want to have that on record. And there'll be some income requirements and other things. If you're accepted into this program, they will do the lead investigation risk assessment. This zip code list has recently been updated. There's a few more zip codes that are now eligible. If you don't have a child under 6, but you are pregnant, you are still eligible. And you can be a landlord if you have tenants who meet these qualifications. I will be uploading to the CURE site a list of all the resources that we're talking to today, and then also provide that so that it can be emailed to anybody who's registered, and perhaps posted on Facebook as well. For the city program, the number is 313-224-6380. They also do have a Spanish line, and you can also email gettheleadout@detroitmi.gov. Or if you have a cell phone camera right now, you can use this QR code as well to get to the form to apply for that program. Now, there's also a program through the state. It covers a little bit different parts of the city, has similar requirements on income, and that you have to have a child under 6 or be a pregnant woman. And you can access their information through https://www.michigan.gov/mi-lead-safe. At mi-lead-safe, you also find a lot of other resources, which we'll talk about in a few moments as well. But those are 2 ways that you can get free services or reduced fee services. If I'm going to pause here and not advance the slide, we have a brand new program in the state. If you do not qualify for either of these programs, but you do have some income and you may be eligible for a loan through the new Michigan Saves Lead loan program. I will include that information for MDHHS. is basically anybody who does not qualify for their program is automatically referring folks to that program to see if they can get a loan. That program only covers home repairs that are directly related to lead hazards, and it will only loan you the amount of money to work on those hazards. So it isn't necessarily going to say that your home is lead safe, like a full abatement would do through one of the other two programs, but depending on your income and your credit score, it can provide you a very low cost way to access some loan money to make those home repairs. The state of Michigan also has a ton of resources on their website at that MI Lead Safe website. You can, again, you can scan this QR code. You can have, there's all kinds of answers to questions about lead paint. Next slide, please. There's also a lot of information on what you can do to protect yourself from lead, also concerns about lead in drinking water, which we won't go into today. Contrary to popular belief, that is not the #1 way that folks get poisoned, but certainly all the attention that the water crisis have had in Benton Harbor and Flint have raised awareness of that. So it's not that it doesn't exist, it's just not the primary way that children are typically poisoned. Next slide, please. You can also get questions answered on ongoing lead exposure. There's also information there about how to interpret your child's elevated blood lead level results. So say your child has a 5 or a 10 or a 20 or a 40, it explains there exactly what that means. Just an FYI, if your child has a 40, they are going to the hospital likely for very painful chelation treatments that can go on for quite some time and are very traumatic, both for the child physically and emotionally, but also for the parent. So when I come back to lead is 100% preventable, it's a pretty big motivation to do that, because nobody wants to see their child do that. And when you're talking about this to other people, they really don't understand what it means for a child to be lead poisoned. So these resources will help you explain to them if you choose to advocate on behalf of all children, and we hope that you will, and increase your information. And then if you want to learn more about becoming a certified lead professional or learning how to use one, Allison gave a great presentation that included monitoring the people that she hired for her home and recognizing that they were not working in a lead safe way. In other words, they weren't working to reduce the amount of lead dust that they were creating by working in the home. So, you know, you think of sanding, you know, that creates dust. There are better ways to sand, and that's wet sanding. There's covering things with plastic. There's taking clothes on and off so that you're not dragging that lead through the home. There's a number of things that are really good, practical common sense that a roll of tape and a lot of plastic and wet cleaning and wet mopping can do. She mentioned that they spread dust and created more hazards in the house. That all is a part of that. So there's a lot to learn there. We will, ClearCorps will be hosting sometime in the first quarter some, she called them RRP classes. That's repair, renovate, and paint. They're an 8-hour class for lead people who want to become lead professionals or contractors who are working in homes, also for landlords, but homeowners and renters and regular people are welcome to come and learn about that process as well. And periodically I have resources available to make those classes free. So I will put, if you're interested in something like that, you can email us at info@ClearCorps, and that's core with an SCORPS Detroit.org, but I'll also put it on the resource sheet so that when those become available, we can let you know. Next slide, please. Getting your child tested, it was mentioned earlier, the importance of that. I do want to reiterate that Allison's experience, not only because her child was younger, but because she wasn't a Medicaid recipient, you really have to push sometimes to get your a doctor to get your child tested. A lot of them don't have facilities in the office. If you don't have a regular healthcare provider or your doctor's giving you some trouble, you can contact the Detroit Health Department, which is on the next slide. If you're outside of the city of Detroit, you can also, I believe, call the Macomb County or Oakland County Health Department, and I believe they may have testing as well. Sorry, I don't have those details readily available. But the health department does provide a lot of services to families, not only for the testing, but should your child have an elevated blood level, they will meet with you and provide some additional education and try to do some linkage to services and follow up with you as well, and give you some things that you can do to help, which we'll talk about a couple of those things next. One is safe cleaning. This is straight from the state's website, so you can also access that at the website I gave you before. It's basically contain the dust, use HEPA vacs, throw away anything that has contaminated with the dust, always wet clean. So instead of mopping and moving that dust around, you're using a Swiffer or a wet mop, and there's a 2-bucket system you can use. They have more information. If you can, get your windows replaced or at least remove the paint chips. It was mentioned before that the dust is the primary way, but when we're talking about pica, in addition to that being a condition, believe it or not, lead paint chips taste sweet. So once a child tastes it the first time, they may be more inclined to want to taste it a second time. Next slide, please. Wet wipes. These do not have to be disinfectant. It can be regular old soap and water, because we're not killing bacteria here. We're removing dust. So there are some very simple ways that you can do it. The mopping, you know, unless you're using Swiffer, does involve a little more work to do a clean water and a dirty water system. But if you are using wet cleaning and wearing gloves to protect yourself from contaminating other surfaces, you will make an impact. There is more detailed information that we'll be able to post on more cleaning steps than just this general overview that I'm giving. Next slide, please. We talked a lot, Dr. Blessman and Dr. Trentacosta, about the science behind lead. And when I first came into this world, that was very informative to me to understand. I'm no scientist, but to understand how nutrition could help work with that science. So it's been identified that calcium, iron, and vitamin C help. They're not going to flush all the lead from your child's system, but they can help make it harder. Please, one of the doctors correct me if I word this wrong, make it harder for the lead to bond to the bones and other parts of the body. So really using foods that are high in sources of calcium, sources of iron, and sources of vitamin C. While that's good dietary practice anyway, it's one thing that you can do to help give your child a better chance of having a reduced impact of the lead on their body. Next slide, please. So as a reminder, get the facts, get your home tested, and get your child tested. But there's a couple other things I want to just mention very briefly that are not covered in the slides. One is that we need you to spread the word. We also need you, if you have a child who has been impacted by lead and you would like to share your story, there's a new Get the Lead Out Detroit coalition that ClearCorps is the administrator for, and we would like to gather parent testimony. And so again, I will have that in the information that they distribute, but you can email us at DetroitLeadCoalition@gmail.com. That's DetroitLeadCoalition@gmail.com to share your story, or just let us know that you want to be involved. This is a brand new coalition that will be launching in 2023, and we're really looking to get folks involved from a wide variety of sectors. The other thing is even if you can't get into an abatement program, there are other home repair programs that might help you increase the health of your home. DTE Energy's energy efficiency program does certain home repairs, replaces furnaces, air conditioning, water heaters, refrigerators, dehumidifiers, some insulation, and a few other things that will help improve the general envelope of your home, so that if you're doing certain things for lead and you can get these other things too, you're going to create a much healthier home envelope in general. There are also weatherization programs that are available through community action agencies like Wayne Metro in Wayne County. There is a Macomb County Community Action Agency, and I believe there is one in Oakland County as well. I don't know the name of that one. So you can leverage and marry these different programs. The city of Detroit also has several programs depending on your income. You can access them through the Detroit Housing Network that they have created, which is basically community development organizations throughout the city will help you do an intake form and see which programs you may be eligible for through the city. So combining all of these things, you may be able to do more to improve the quality of your home, even if you can't get the full lead abatement through one of the city or the state programs. So in closing, I think there might be one more slide. Okay, you can skip that one. I'm sorry. I talked about that out of turn. Between the health department, the state of Michigan, the CDC, and the coalition, there are a lot of resources out there. Again, I will post a one-pager to the CURE's website that can be distributed as well, or posted on Facebook so that you can access all of these things. But you know, the important thing to remember is lead poisoning is 100% preventable. I had no idea when I was raising my child that lead poisoning even existed, and I was living in a home built in the 1920s, and he was a grown man before I even learned about it. So I, in retrospect, worried, what did I expose him to? And lead is a health issue that has often a housing cause, but often a housing solution. So through changing some of the personal ways that you work within your home, improving the nutrition of your child, and really being educated about home repairs and the things that you can do, you can make a major impact on not only your home, but the homes of your neighbors and families and friends who you share this information with. And with that, I will open it up for questions.
Thank you so much for that presentation. Very good. I will state before we get to some of the questions, if I can comment too, one on the HEPA-vac issue. That's an important piece if you are vacuuming, because regular vacuums without that will have a tendency to spread the dust in your home, and in particular, put it in the air so that you can breathe it. So it is important that there be a HEPA filter in this regard. The other thing with regard to nutrition, and I saw a comment in there about nutrition, that gets back again to my opening comments about errors of omission and errors of commission. And remember, errors of omission are things that your body is looking for that are not present. And so again, where there's not calcium, where there's not iron, where there's not vitamin C, and vitamin C helps to improve the absorption of iron also. If your body doesn't see those things, it will preferentially grab the lead if it is there and absorb this and take it to places where it is doing no good. But there are other errors of omission too. There's an area of mental fitness, so you got to have the right thinking. And let me just tell you that happiness is where the magic happens. You got to have right eating, and even being careful of when you eat. You got to move right. So, avoiding being sedentary and doing your stretching. And more importantly, you got to kind of find your purpose and meaning in life, and where there is meaning, and improve social relationships, things go better. And I'm just going to say, as we move into the holiday season, just from some other things that I've seen, I'm just going to say, do not pass up the opportunity to tell your loved ones that you love them. And I'm going to say, even for some of those people who maybe you don't love, you could spread a little love to them also. So that being said, I don't know, Ms. McCloskey, you almost look like you were going to say something.
I was. I'm glad you brought that up about the HEPA vax, because I should also have mentioned, if you can, remove carpeting if it's in your child's home, preferably through your whole house. But if you can only remove it one place, remove it from your child's room, because I've recently learned that it takes 10 minutes of vacuuming in the same spot, which is a very, I think, and Mary Sue, you might know this number better. I believe it was 1 meter square, 10 minutes to remove the lead dust from the carpet. And if you don't do it for the proper length of time, all you're really doing it is bringing it to the surface, which makes it easier to spread around again. And I mean, it's, in other words, very impractical to think that vacuuming is going to help. I personally also use a HEPA vac to vacuum my wood floors, because I don't have carpeting, but I'm hoping that helps there as well.
I appreciate that information about the 10 minutes of vacuuming. I was not aware of that. That's good information. Are there other questions? Let's see. Michelle, do you think we missed any? I mean, Rochelle, I'm sorry, Michelle. Rochelle.
I am
Man,
checking.
I need to
don't
drink
see
more
any in
coffee
the
today.
chat.
I think it has been a great session, to the point where you guys deserve applause. Wait, I got applause here, I think. Let me find them. Where's my applause? Okay, sorry, got a little out of control there. No, I hope folks found this very helpful. I've been involved in environmental health for some time. I found it very helpful myself. In particular, realize that all those who should be in the know are not always in the know. So you do have to take some responsibility, for looking out for yourself, and where we can, get to those places where it's called the social ecologic model, where you look for interventions on an interpersonal level, intrapersonal level, kind of community, environment, and policy ultimately. So, where we can get to those policy things, it just makes doing the right thing easier. So where there's opportunities to be advocates for those things, please do that. As stated, this presentation will be available, and we would appreciate your sharing, and helping to spread the word. Be fantastic. Any other comments from the team? Any of the presenters? Any final comments that you would like to make?
Just want to make sure everyone's aware. Two things that we have an evaluation that Carrie Leach put in the chat. Yeah, it's just put it back in there. So for those of you attending, it'd be great if you could fill out the evaluation. And also, I believe it was also Carrie that put in the chat, we are planning an advocacy event for, she says, February, to help people know how to get involved in making change. So Dr. Blessman, with your mentioning of advocacy, which has been a theme throughout today, I would encourage folks to stay tuned for information on that event.
Gotcha. Awesome. Ms. Chapman, was there anything that you wanted to say to the group?
Thank you. That's it. Thank you to you, Dr. Blessman, and to Ms. McShane, to you, Diane McCloskey, and we also have some of our CAB members and our internal planning committee, Lucretia Daniels, Yolanda Hill Ashford, James Blessman, Sandra Turner Handy, Melissa Cooper Sargent, and our leaders, Christian Acosta, Nick Schreck is on here, to Harry Leach as well. And I feel like I'm missing somebody, but thank you to everyone. That's all. And especially you, Dr. Blessman.
Oh, absolutely. I'm glad that you had me. I'm always happy to help out where I can. Carrie, anything you want to say?
Yeah, thanks, James. No, you guys covered it all. Chris got my notes in the chat with evaluation. Nick and I are working on the advocacy event. I just want to say and give a shout out to Diane McCloskey, who really helped shape this event so that we had the voice of a parent with the lived experience, such an important part of this. And so thankful for Allison for her time. And of course, Mary Sue, who is a former member of our community advisory board at Cures. I don't know if anyone will ever let her retire, but I know why they won't, because she's an advocate and a tireless activist in this work. And I just thank her for her time as well. So that's all. And
Awesome.
happy holidays, I would say to everybody.
Right.
And I do want to thank Mary Sue as well and the Wayne State University D-Led program, because they're my connection to get wonderful people like Allison who are willing to share their stories.
Awesome. Anybody else? Nick Schreck, you want to say anything? Is our legal person?
All I would say is great presentations, really good info. And yeah, as Carrie mentioned, we will be doing an advocacy event either end of January or beginning of February, so be on the lookout for that. And that's where, building on a lot of the great comments that Allison made about, how to, reach out to city council members, how to reach out to state and federal officials about the importance of testing, and also to make sure that programs are available to everyone. We'll be building on those comments as part of our advocacy event, and that's really intended to help you all share your stories, share your experiences with decision makers, elected officials, to make sure that the resources flow where they need to, and that where we need changes to the law, where we need changes to regulations, so that all cities have a program, like Detroit, and that Detroit's program actually works the way that it's intended. That's kind of what we'll be talking about in our next meeting. So thanks for teeing that up so well. And again, I just really appreciate Allison, Diane, Dr. Trentacosta, Dr. Blessman. Thank you all so much for sharing your experience today. And hopefully we'll see many of you again after the holidays, when we start talking about taking some of this information and putting it into action. Thank you.
Awesome. Fantastic. Any CAB member? Don't feel like you have to, but you can. I just wanted to give you a little space if you need it. Wait, I got something for that too. Where's my? All right, hearing crickets.
The literal crickets have showed up.
Yeah, the crickets have showed up. I think that means that we've done our job, and we've done a good thing. And I just want to say thank you so much for spending your afternoon with us. We hope that you learned some things of importance, and wish you the absolute best during the holidays. All right. Take care, everybody.
Thanks, everyone.
I had
To
a
everyone.
question.
Hi, everyone.
Oh, somebody said they had a question.
Yeah, I put it in the chat, but I wanted to know if you had any information on testing for asbestos tile or linoleum.
Oh, yep, I do see that. I don't know. Let me see. Sandra's leaning in.
Did Diane leave already? You can send her to Diane, because they have a wide range of experts on asbestos and lead that actually does like the classes. They do a lot of the training. ClearCorps does a lot of the training around this to get certified or to actually work in your own home. So she would be able to give her or lead her to someone.
Great. I do see some questions also about black mold. I think that, again, most of what we assembled today was trying to address issues of lead. As mentioned, there are other hazards in the home. I think what we will do is make sure that if there are some particular questions, you can send them to us. And this will be on the website also, where I think folks can put in those questions, because we're always looking for what should we be addressing in future e-chats. And so those questions kind of help us find the people that need to be a part of this effort. Okay. Awesome. All right. Thanks again, everyone, for your presence.